Queensland records 10,391 new COVID cases in the latest testing period. The state recorded an additional 12 deaths, 1/3 were not vaccinated. 833 people are in hospital, that's 15 more from yesterday, and 53 patients are in intensive care. Queensland's Chief Health Officer, Dr. Gerrard, spoke about the progression of COVID in the state.
It's interesting also to see that we're seeing the epidemic occurring in sort of two different ways. We're seeing it occurring geographically. So clearly the epidemic started on the Gold Coast between Christmas and New Year and then spread very rapidly to the rest of Queensland. So geographically it is right across Queensland. But also in terms of age groups. It started in the younger age groups, younger adults, particularly people in their 20s. What we're seeing in hospitals reflects the next group, which is the older age group in particular, and those with comorbidities. And that will be the last group that we will see, and in many ways clearly the most important, because these are the ones that are sickest and the ones that are most likely to experience complications, end up in intensive care, and even some will die. So this is the last group that we will see to be infected, but clearly the epidemic is progressing.
Dr. Gerrard also believes the state is doing better than the modelling expected.
So far, the outcomes in terms of hospitalisations and complications is significantly lower than what we're expecting. So we're expecting to see in the next week hopefully further reductions in hospitalisations here in southeast Queensland and then elsewhere in Queensland.